Good afternoon, Indy.
Oh,
Hope
hi.
you're well. Hope you're well.
Yes, thank you.
Um, Thank you so much for taking the time out to answer some of the questions of parents who are part of the Tllid community.
Yeah,
We have some really interesting questions, really interesting topics to cover. Hopefully, we can cover all of them in 30 minutes. But just in
okay.
case we don't, maybe we do one more of these conversations at a later
Yeah,
point in time. I'm hoping that this is the first of many conversations like this.
sure.
Yeah. So I think just going down the list of questions that have come up, um, couple of parents who have toddlers like between the age of 3 and 6 years
Hmm.
have indicated that their children are getting constipation fairly frequently. It seems to be a bit of a recurring theme. So there are questions around both prevention and if the child is suffering from constipation, how can they manage it at home, when do they need specialist care, and so on and so forth. So if you could talk a little bit about that, that will be massively helpful, I believe.
Yeah, thank you. I think uh, so bowel problems as such in children is probably one of the commonest conditions pediatricians would see in their clinics.
Mm-hmm.
And in the slightly older kids, like in the primary school children, it's usually tummy pain,
Sure.
which may or may not be associated with constipation.
Mm-hmm.
But in the younger ones, the toddlers, the preschool, and also the school aged ones, the younger ones, constipation after abdominal pain is the commonest condition that we see. So it is very, very common.
Right.
And I think the thing about constipation is I have seen over the years, there are certain myths and certain things that are passed on from generation to generation, which sometimes are not very helpful in the management of constipation.
Mm-hmm.
Okay? I think the first hurdle to cross is to acknowledge there is a problem,
Mm-hmm.
because sometimes it might happen as a one off and then nothing happens for a week or two, and then there's a problem again and you're thinking maybe it'll go away, maybe it won't. So the one thing I tell all parents is, when you recognize the problem, get advice for it,
Yeah.
treat it early,
Yeah.
treat it aggressively, and treat it for as long as is required. Yeah? Don't get too caught up with, oh, this is going on for too long and this is not helping, or the dose is too high or whatever. Just
Yeah.
the harder you hit it,
Mm-hmm.
the more likely it will get better,
Mm-hmm.
because it becomes like a vicious cycle, because the thing is, the child is in pain,
Right.
and the pain, they remember the pain. So
Mm-hmm.
then ahead, even if they're not actually that constipated, just the thought that they need to open their bowels, that they remember how it hurt like 3 days back,
Sure.
and that will make them hold on. And then
Right.
that withholding behavior comes in, and then it
Right.
becomes like a vicious cycle. So it is
Right.
best to break it, as soon as you can.
Okay.
Yeah. And
Okay.
before I go into more of the thing, for whichever parents are listening,
Mm.
one of the very good websites to look up is called ERIC, like the name ERIC, ERIC.
Okay. Okay.
It's a UK based organization
Okay.
which gives very helpful advice
Mm-hmm.
for parents who have children not only with bowel problems but bladder as well,
Mm-hmm.
because sometimes the constipation and soiling goes hand in hand with the daytime wetting and the
Sure.
nighttime wetting. Yeah.
Sure.
So Eric gives a lot of advice about how to manage it. It explains things very well. So I
Mm-hmm.
think any parent who has a child with constipation and they're thinking of starting treatment,
Mm-hmm.
it will be very helpful to look up the Eric website. It's free. Anybody can just, you don't have to
Sure.
pay. You can just read all the information. There's some
Right.
very good videos as well that,
Right.
people can read. I mean, have a look at, which will also help their understanding.
Right.
Yeah.
Right.
And just from the top of my head, I mean, feel free to stop me anytime, Saram, if you want. But
Yeah. Yeah. Yeah.
the,
Of course. Of course.
in no particular order.
Mm-hmm.
But the thing is, you decide whether you expect preschool and early school year children
Mm-hmm.
ideally to open their bowels every day.
Right.
But if they don't go every day, you would
Hmm.
want them to go at least 4 or 5 times a week. Yeah.
Right.
So
Okay.
if they, sometimes parents tell me, "Oh, my child goes 2 or 3 times, and they're not in that much pain, but the
Hmm.
stools are really large."
Hmm.
That in itself might suggest that there is constipation. Because sometimes
Right.
people have this belief that if it's constipation, meaning it should be really hard
Mm.
to push out and there should be bleeding. And yes, that does happen, but that's not
Mhm.
the only thing that happens.
Right.
And sometimes parents feel my child is not constipated, but they are soiling.
Mm.
Again, usually constipation and soiling go hand in hand. It's very, very rare that a child soils without actually having constipation.
Right.
So the biggest battle for me is to get the parents on board, to convince them there is a problem.
Hmm.
Just listen to what I am saying,
Hmm.
try it. If
Hmm.
it doesn't work, then we can
Hmm.
think of the next step. Yeah.
Okay.
And
Okay.
the first thing to remember is that in most cases,
Hmm.
in over 90% of cases of constipation,
Hmm.
there is no physical reason. Yeah. it's
Right.
it's something that we call it's functional. So there is no blockage of the bowel or narrowing of the bowel, because parents get that in their head that my child needs some surgery to make this
Sure.
better. They don't. Most of
Mm.
the I can't even remember the last time I saw a
Mm.
child who needed any surgery for their bowel.
Mm.
So it
Mm.
is a functional problem.
Hmm.
Diet, fluid intake, yes, they all do make a difference,
Right.
but it's not. If it has become a problem, you can't just sort it out by diet and
Sure.
increasing the fluid intake.
Sure.
One aspect of diet that does work, we've seen it
Mm.
work, is the dairy consumption. So if the child is drinking quite a lot of milk or
Right.
having dairy products like yogurts and cheese and all that, then you might want to cut back the dairy and milk intake. And if
Okay.
it is quite a big problem, you might even try a couple of weeks of completely dairy free or milk free to
Right.
see if it makes a difference. Yeah.
Okay.
So
Okay.
that's one dietary aspect you might want to look at. I mean,
Right.
it'll be nice if the child can eat more fruit and veg, but they will only eat as much as they want to eat. So
Yeah. Yeah.
rather
Yeah.
than fighting around the diet and the fluid intake, you
Yeah.
might as well treat it with some medication.
Yeah.
Yeah.
So indeed, sticking to the diet piece,
Yeah.
is there anything that parents can do from a diet perspective which can
Yeah.
help prevent the onset of constipation? So are there any kind of food items that can help, prevent the
Yeah.
onset of?
Yeah. There are things like prunes, but the child needs to want to eat. The prunes are not very, like dates and prunes they might want to try, or
Sure.
even like prune juice or
Right.
figs. Yeah.
Right.
But yeah, if they're willing to eat that, that's fine.
Hmm.
But apart from that, I think the easiest thing to do might be to reduce the dairy.
Right.
If the child is used to drinking a lot of milk, they're not going to suddenly accept that you've reduced their milk. uh, in, so what I suggest you start diluting the milk. Say
Mm.
instead of giving them a glass full, you do
Mm.
like 3/4 and add water, and then half and then
Mm.
add water, so they still think they're drinking milk. And then
Mm.
slowly drop it down till
Mm.
you can try and keep the milk intake as low as possible.
Mm.
If there is no benefit after a couple of weeks of that, then you can just go back to where you were. But it's
Right.
worth a try, because it does help quite a few children just by reducing the dairy intake.
Right. Right.
Yeah.
So what's interesting is in what you're saying is, coming from an Indian family, and
Hmm.
I can speak for both North Indian families and South Indian families because I'm a South Indian who grew up in Delhi.
Yeah.
Uh, Milk is a big part of the diet, especially for children.
Yep.
Most parents, especially mothers, would insist that they have a big glass of milk first thing in the morning, especially if they are going to some sort of nursery or school
Yes.
or whatever. Um,
Yep.
so that theory of trying to cut down on milk and dairy products to alleviate some of the constipation related issues or bowel related issues is very
Hmm.
interesting, and it's a
Yep.
new one. Could you could
Yeah.
you um, could you say a little bit about the Indian diet style and what can be done from that point of view?
Yeah. The thing, I don't want people to get the wrong impression, Sarah. If the child is drinking quite a lot of dairy products and they don't have constipation, then there's no harm.
Right.
It is the ones that have the constipation or the bowel issues
Right.
where you would try to reduce the milk. Yeah.
Okay. Okay.
Sometimes, children get used to drinking milk via the bottle or whatever when they're, little.
Yeah.
And
Yeah.
then it becomes like a habit, and it's easier to drink milk than to have solids, whereas actually
Sure.
it's the solids that they need in terms
Sure.
of the vitamins and the iron. So we do need to cut down, especially in the Indian things, to cut down on the milk intake anyway, so
Hmm.
that you can improve the solids intake.
Right.
Yeah.
Right.
But otherwise, the Indian diet, that the usual Indian diet would be very good for, like the fiber content, and
Hmm.
all, whether it's vegetarian or whatever, all the diets from India would
Hmm.
be very good to prevent constipation. The only
Right.
problem is if the milk intake is too high, or the
Hmm.
fluid intake is not much, or
Hmm.
that's when the problem is. But if the child is having your, the bog standard normal Indian diet, I
Yeah.
don't think anything needs to change with that. That
Okay.
in itself is good enough. Yeah.
That is good to hear. That is good to hear. So one thing that came up in a question is, so let's say unfortunately a child is suffering from
Yeah.
constipation. There is some theory that massaging the child's tummy, especially in certain directions, can help alleviate some of the bowel movement. What is the kind of basis for that? Is there any evidence that that works?
I think the doing it as a routine,
Hmm.
I'm not sure that will particularly help.
Okay.
But what I have seen, and I guess even I have done it as a parent, is when you see your child in pain and distress,
Hmm.
then to alleviate that distress and the pain, you might massage the tummy, which is
Right.
fair enough. But doing it as something that you do every day in the morning that
Hmm.
helps them to go, I
Hmm.
am not aware of anything that suggests that that is helpful.
Okay. Okay.
Some parents get so desperate because they can see the poo's coming out of the bottom, but it's not coming out. So they have to
Yeah.
literally put their finger inside to try and bring it out. So
Yeah.
at the time the child is in distress, you can try whatever, but I
Yeah.
don't think there is a sort of daily routine that you can do to help them with that.
Right. Right. Okay.
Yeah.
So that's quite helpful, and I'm hoping that all of that answered the couple of questions that came up
Mhm.
on constipation. Moving on to another morning routine or a morning activity.
Yeah.
There is a question that from a parent that they have a 4-year-old child, and that 4-year-old child gags every time they are brushing their teeth, and they've tried changing their toothpaste, and what they're wondering is whether it's to do with the toothpaste or the toothbrush. What's the kind of yeah, what could it be?
Yeah, it's interesting. I think the first thing that struck me when you mentioned this, Sairam, is that
Yeah.
why is a parent brushing a 4-year-old child's teeth?
Mm,
Why isn't the child doing it themselves? Yeah.
mm, yeah.
Yeah. At 4 years, you would expect children to be able to brush their teeth.
Okay.
You might want to supervise it. Yes, you might want to be around. And if
Mm,
they haven't done it properly, then you might just help them a little bit here and there. But I
right.
would let them have that independence to brush their teeth. Yeah.
Right.
The thing is, because if somebody else is doing it and
Mm-hmm,
the brush goes quite a bit inside the mouth towards
mm-hmm,
the throat,
mm-hmm.
it might create what we call as the gag reflex. So you kind of gag when something is going towards the back of your throat,
Right.
and that is what is probably what is happening to this child. And
Okay.
I guess in this era of COVID, when people have got swabs done, I don't know about you, but there are some people like me. I am
Yeah.
very sensitive to anybody putting anything in my throat to do a swab.
Sure.
I used to prefer to do my COVID swab through the nose, which I felt
Right.
was slightly easier than for the throat.
Right.
And definitely if somebody else is doing it for me, because I know how far I want to go.
Sure.
Whereas if somebody else is doing my swab,
They wouldn't know it.
I'm always this anxiety that they might go too far and it will cause the gag reflex. I think that's what it is.
Right. So it's got nothing to do
Yeah.
with the toothpaste. It's perhaps
No, I don't think
just
so. No.
right. Right.
Yeah. I think, yeah, they
Interesting.
need to try, just let the child do it themselves and see
Yeah.
if things settle down with that on its own.
Right.
I
Right.
can't think of any medical reason otherwise for
Okay.
this. No.
Okay.
Yeah.
Fantastic. There is one other question, and I think there are a couple of more that I'll cover. But one question that is kind of more behavior related,
Mhm.
and this is a question on the fact that the parent has a toddler boy who has a tendency to hit the parent if the child doesn't like what the parent is telling them.
Mhm.
What can the parent do from a behavior management perspective in this instance?
Yeah, I mean, this is quite a broad topic. I'll just try and cover it briefly for now. Yeah.
Sure, sure.
There are certain rules of parenting
Mm-hmm.
where these words are all important. It's not just one or the other. All this needs to happen for it to work. Yeah.
Right,
So one is you've got to be consistent.
right.
So every time there is a behavior that is undesirable,
Mm-hmm.
it gets the same response. We'll talk about how the parent can respond to this hitting, but in general behavior management.
Sure,
Yeah.
sure.
So if the child does something that the parents think is not right,
Mm-hmm.
then they point it out, and they point it out each time. They
Mm-hmm.
don't, if the child does it in front of them and the child knows you've seen them do it,
Mm-hmm.
but you tell them off only about 7 or 8 times out of 10, but not 10
Mm-hmm.
out of 10, then the
Mm-hmm.
child doesn't know which time is this. Will my parent let this one go, or
Yeah,
will they tell me off? Yeah.
sure.
So it has to be consistent.
Mm-hmm.
Another very important thing is both parents or whoever the important caregivers are in the family have to
Mm-hmm.
work together. Everybody has to do the same thing.
Right,
Dad can't ignore it and then mom is telling the child off. Everybody has to do. So the parents have to decide how are we going to deal with this, and
right,
both take the same approach.
right.
Yeah.
And just on that point, Indy, if
Yeah.
if the parents are living with the grandparents, then
Yes.
presumably the grandparents also have to be
Yes.
consistent.
Yes. That's why I said the caregivers. Yeah.
Right,
Yeah.
right.
Yeah. Because that's what's happening to my niece in Italy. She's got a little boy who has all these eating issues, and the
Right,
grandma keeps giving in for everything.
right.
And my niece can't do anything because she knows what needs to be done, but
Sure,
there is no point because her mother-in-law is going to give in,
sure.
and then it'll not work. Yeah.
Yeah, yeah, yeah.
So consistency, everybody doing the same thing,
Right.
being firm. Yeah. So
Mm-hmm.
your voice needs to change, that it suggests that this is something different. So you're being
Right.
firm, you're being brief. No point telling little children, don't run on the steps and you'll fall down and you'll hurt your head and we'll have to call an ambulance and then you'll have to go to hospital. You just
Yeah.
say, do not do that, and that's it for the
Right.
younger kids. Yeah. So not
Right.
too much explanation, but be firm,
Mm-hmm.
keep the instructions brief,
Mm-hmm.
shift the focus from the undesired to the desired behavior. So if you see your child behaving, but as all of us as parents, if we see your child doing something you expect them to do, then you
Mm-hmm.
don't point it out. But
Mm-hmm.
the moment they do something wrong, then
Mm-hmm.
it's pointed out. So if the child realizes that they are being noticed for doing good things, then they don't find the reason to do anything, wrong, that will suddenly
Right.
get the parents' attention. Yeah.
Right.
With little children like toddlers, distraction will help us. So if they've done something naughty, you
Mm-hmm.
just take them off that situation, go on, move on to something else that you know that they like,
Mm-hmm.
to try and divert the attention from them.
Mm-hmm.
Yeah. So going back to this example of, so if the toddler is hitting the parent,
Mm-hmm.
the first thing you do is probably just raise your finger and say no. Just that's it. No, nothing else. Just no. Yeah. Because children understand no before they understand yes. Yeah. So they know
Right.
what no means. So you just said,
Right.
this is not. So they get the clue that this is not acceptable,
Right.
and then, whatever affection and all you would normally give them, just
Mm-hmm.
take it away for a little while. So
Yeah.
they should realize that mom and dad are not happy with what I've done, and then
Mm-hmm.
just go back to being your usual self after a little while.
Mm-hmm.
But next time the child hits you again, you have to do the same thing. You again say no,
Right.
take your affection away for a bit, and then go
Right.
back to no. Don't let it go even once. Yeah.
Right.
And even little children are very clever. They know what they can get away with,
Yeah.
between mom and dad, which one is the easier one to manipulate. Yeah.
Yeah. Yeah. Yeah.
And that they have to work together.
Yeah. No, fair enough. Fair
Okay.
enough.
Yeah.
So one thought that came to my mind when I saw this question first is
Mhm.
it's a 3-year-old boy,
Mhm.
and obviously I am no expert, but I immediately went off thinking boys are generally, they tend to be a bit more aggressive, a bit more
Mhm.
physical than girls. Is there am I being completely wrong in my thinking, or is there any basis for that kind of preconceived notion?
Uh, Maybe not in 3-year-olds,
Right.
but I mean, we do not, unless this 3-year-old is then slowly going to declare themselves to have something like attention deficit hyperactive. The ADHD that we talk about
Sure.
is
Sure.
commoner in boys. Yeah.
Right.
So that we know, but this kind of behavior of children hitting their parent is
Hmm.
not a marker of ADHD or anything. No, it's just,
Okay.
these are kids being kids, they're pushing the boundaries.
Right.
So they need to, all children like to push the boundary because they want to know how far can I go
Right.
before I'm told off. So if it made clear that this is not acceptable, this is it,
Hmm.
yep, and
Hmm.
this needs to stop, it
Hmm.
should do. If the parents come and tell me, look, doctor, whatever you told me I have done, and I believe that yes, they have really done all this and still it is not getting better,
Hmm.
then you might start thinking, is this because there is some kind of a neurodevelopmental issue
Right.
like ADHD or something? Yeah. But
Right.
I
Okay.
wouldn't think of that as the first thing if I just heard this question about, it's quite common for toddlers to hit their parents. It's a
Yeah.
question of how we manage it. Yeah.
Yeah.
It's the behavior problems in children are less to do with the children. They're
Yeah.
more to do with how the parents deal with the behavior.
Right, right.
Yeah.
And I remember you told in one of our other conversations that it probably, if parents start following this 5-step approach, it'll probably
Yeah.
start getting worse before it gets better.
Yes, yes, that's true. Yeah, good you reminded me of that because they are wanting to see how much do I need to push further
Yeah,
before mom and dad give in. Yeah,
yeah.
and the thing is, like the, if mom and dad have said no and the child starts crying
Mm-hmm.
and they cry for 5 minutes and then the parents give in. Yeah,
Mm,
then
mm,
and then some I've told the parents, look, don't give in. So the parents
yeah,
decide, okay, we won't give in. So they wait and the child cries for 10-15 minutes, but then
sure.
again they give in. Yeah. So
Right.
then all the message the child gets is that if I just push it a bit more,
Mm,
mom and dad are going to give in. But it's when that thing goes straight in their head that if mommy or daddy say no,
mm,
the no means no. It doesn't
right,
mean maybe if you scream a bit more, I will give it. It is a
right.
no. Even if the house comes falling down, it's still a no.
Right. And what's fascinating is that talking to what I'm learning is that children at even such a young age are quite
Yes,
intuitive, are quite intuitive.
yes,
So
yeah,
they pick up on these kind of signals about what's my territory, what's not
yes,
my territory, and things like
yeah,
that.
yeah. Hmm.
Yeah.
I give you another example, Saram. This was
Yeah.
probably slightly older kids, like say 4 or 5-year-old kids.
Sure. Sure.
Say this child wants to go to play to their friend's house next door. Yeah.
Mm-hmm. Yeah.
So they go and ask their mom. They know,
Yeah.
I mean, they know they need to ask mom, but they know daddy is the softer one of the two. So
Sure.
they go and ask mom, can I go to Sunny's house to play?
Hmm.
And mom says no. Yeah.
Hmm. Hmm.
So then the next thing they do is then they go to daddy and just ask daddy again, like, can I go to Sunny's house? Yeah.
Mm-hmm.
So ideally, what daddy should be doing is asking that child, have you asked mom? Yeah.
Right.
But
Right.
if then daddy's without asking that, and have you asked mom and what has she said?
Hmm.
But if dad doesn't ask that question and he tells his child, yes, you can go to Sunny's house, then it
Right.
becomes a problem because mom has said no, dad has said yes. So now
Right.
mom and dad have to fight it out to decide, and that's how
Right.
the children will play on that. Yeah.
Right.
So
Right.
the communication between the parents is key.
Right. Very interesting. Very interesting. Just conscious of the time. We have about four
Yeah.
minutes. One other question that's come up is from a couple who have been following a vegan lifestyle.
Yeah.
So they are obviously non-dairy,
Yeah.
no meat, no fish, no eggs, and things like that. So they are quite conscious and worried about whether their diet lifestyle will provide the right nutrients for their infant's growth.
Hmm.
So infant and toddler,
Yeah.
as a child grows. So do you have any thoughts on that?
I think this is a slight, I can just make a generalized statement.
Sure.
Obviously, I don't know this child and whether they are the right weight and height and everything for their
Mm,
age. So
mm,
it will be difficult to be very specific for this child.
sure.
But the general theory is that if your child is eating reasonable amounts of food, so there's no worries about, that they are eating only very little
Mm,
and they're eating the diet that the rest of the family are eating. So in terms of
mm,
the amounts and everything else, it is adequate
right,
and they are growing. There is no
right,
particular at the most, I might, just get an over the counter, like a multivitamin supplement with
right,
vitamin D or something. You don't have to. If
right.
they think that this child is eating enough for their age and is eating everything that we eat and we are fine, then
Right.
I don't think there should be a problem.
Okay.
If they are worried, then I think the best approach would be to see a diet, to make a note of what they're eating, not just
Right.
the food, but the
Right.
amount as well. Like
Right.
keep a diary for a week or so,
Right.
consult a dietitian, and
Right.
they'll be able to work it all out to see in terms of calories and the minerals and nutrients and everything, vitamins. Yeah.
Right. Right. Fantastic. No, that's very helpful.
Mhm.
That is very insightful, and I think with a lot of couples shifting to a vegan lifestyle for various reasons,
Yeah.
this insight might be very helpful in a sense that it's very practical. You're as long as the child is eating enough and developing at a pace that is right for their age, you don't have to worry. But if there are concerns,
No.
then you
And
just
they're growing, their weight and their height.
yeah,
You can look up growth charts online, I'm sure. If you can just plot your child's height and weight on a chart, and if
sure.
they are following that chart, that's fine. Yeah.
Sure. Okay. So that's great. I think that brings us to a very nice and tight end to this conversation. I'm hoping all the parents who sent in their questions are able to go away satisfied and knowing that they've got a bit more information on hand. So thank you for the time. I know it's a
Thank
weekend,
you.
but I'm hoping that we can
Uh-huh.
do a few more of these in the coming weeks and months. As always,
Yep,
a pleasure
definitely.
talking with
Yeah.
you. Thank you so much, Indy.
Thank you.
All right,
Thank you.
have a wonderful day.
Right. See you then.
Bye.
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 Bye,
Bye.
Saram. Bye.